patients oftentimes present to the ER many hours after their initial presenting symptoms. This could be while they're at work, while they're at home. The symptoms that they experience can be very subtle in nature, and the real key here is to recognize it early.
One of the things that we try to do with rural healthcare is make sure that we get the services that are time sensitive to the patients as quickly as possible.
Numbness or tingling or inability to move one side of your body or the other, or a severe headache. If you develop any of those things, or your relative develops one of those things, it is very important that you make it to the emergency room as soon as possible.
The grimace is something that really a lot of patients do brush off as possible tics or just really symptoms that kind of come on and come off within a quick amount of time.
If you think that somebody is having a stroke, ask them to smile and see if one of the side of their face is drooping or not. Ask them to move their arms and see if they're able to move, lift up their arms, hold them out, or if their sensation's intact. Talk to them and see if they understand what you're saying or if their speech to you is making sense. If you notice any of those abnormalities, then call 911 right away.
As far as treatment goes, it very much relies on the type of stroke. The two main types are ischemic and hemorrhagic. What that basically means is there's either a disruption of blood flow to the brain, which is usually caused by a blood clot, ischemic, or a hemorrhagic stroke, which is more of a bleed to the brain. The way we treat ischemic blood clots or ischemic strokes is mostly by clot-busting drugs. The difficulty here relies on the fact that it needs to be done within a very specific time window, usually between up to about 3 hours from the initial presenting symptom. Time is of the essence, and there's a saying which goes, time is brain tissue, and that's really the truth when it comes to preventing and treating strokes.
If you're having a hemorrhagic stroke, that typically means you're having some bleeding on one side of your brain or the other.
As far as treatment with regards to hemorrhagic strokes, that's a little bit more of a complicated, procedurally driven treatment protocol, which relies on specialists at usually larger institutions.
Diabetes puts you at higher risk for a stroke. Untreated or even sometimes managed hypertension or high blood pressure. Certainly if you have atrial fibrillation or any kind of cardiac disease that has some ongoing treatment such as heart failure. All of these things are disease processes that can lead to the development of a clot, which then could, over that period of time, lead to someone to develop a stroke.
If you have had a stroke and you have had treatment, the important part is to understand that it doesn't stop there. It's very important that you follow up with your primary care physician and your neurologist.
I just want to assure the community that we're here to serve them. We have partnerships with EMS, with the air ambulances, collaborations with the hospitals who do the clot busting surgeries that we do not have available here. So again, the quickest place to arrive as soon as possible may be your local ED, but they will have the resources lined up and ready to take care of the stroke and get you treated quickly.
I think it's always better to be safe and get evaluated.